to talk to Eloise Sultan, who represents her company, BioCellRx, and she's going to give us the realistic ways that stem cells can help with therapy. Eloise, thank you for being with us today.
Thank you.
I have used your stem cells in the past to turbocharge my prolotherapy with PRP for my soft tissue injuries. Enlighten us. Tell us, how can mesenchymal stem cells help with soft tissue injuries of, let's say, ligaments, tendons, and muscles?
That's an easy answer because MSCs have one job, and that's to heal and repair. Another factor that they do is they are able to turn into, differentiate into any tissue that needs the repair. So if you are injured, say, you know, your wrist, and I actually, you're a great success story, Dr. Robert. I love hearing your feedback and how it helped you. So I use your story all the time with my clients and my doctors, and how it has helped you in your practice. So every time we're injured, there's that specific injured tissue or organ secretes factors like SDF1, and then that signals our MSCs in our body. They have a honing effect to go towards inflammation, and they go towards that site of injury, and they start their paracrine effect to duplicate, replicate, and start healing and waking up our local cells to start the healing process.
I
So
see.
they're packed with cytokines, growth factors, proteins, interleukins. It's been in clinical research for the last 30 years. There's thousands of clinical trials. Paper after paper has proven their results and their efficacies. They go through phase 1, phase 2, phase 3 clinical trials. They do get stuck. You know, we have animal studies, we have human studies, we have even clinical studies within the doctor's offices, and especially ortho, where they use it for their patients. Before and after assessments, remarkable, you know, just like yours story,
Right.
remarkable feedback of mobility, range of motion. So it is doing the job. It's not an overnight regeneration. It takes anywhere from 2 months, 2 years, it depends on the person. But with our clients, we've seen a lot of pain relief. You know, it lessens the inflammation, it helps bring you back to homeostasis, helps the immune system to fight that inflammation.
Well, I can tell you, my last injection was over a year and a half ago. Mm-hmm. My pain went from about a 6, 7 out of 10 in my thumb down to 0, and right now it's maybe, honestly, it's about a 0 to a 1 right now. I'm here to get it injected just to try to keep progressing forward, hopefully to get it to stay at 0 forever.
Well, in your line of work, you're rigorously
Yes, my orthopedic surgeon said that I'm going to need surgery because I do surgery. He says, oh, you're severe arthritis, you're not going to be able to do surgery anymore. That was 3 years ago.
Wow.
And I have no problems doing surgery now thanks to the prolotherapy with PRP with your stem cells. Mm-hmm. So my understanding is that the MSCs are little packets of information, and when they're injected, they go into that area, they transmit that information, recruiting your own body's healing, sending out healing signals, recruiting your own body's healing cells to come in, reduce the inflammation, and stimulating your own body's stem cells to actually regenerate healing in the area. And you said differentiate, so sometimes these MSCs that I'm injecting may actually join the party.
Yes.
They might actually turn into cartilage,
yes.
De novo in my joint, and become new cartilage. It's possible.
That's correct. They have the ability to turn into tissue, cartilage, bone, fat, muscle. So if you have injuries to any of those tissues, as long as there's a bridge, like a scaffold, for them to regenerate.
Okay. So I need some cartilage.
Yes.
And then they can say, oh, here's some cartilage, and we're going to turn into cartilage.
Yeah, in ortho, like if you have a knee surgery, as long as you have some cartilage, they have a bridge to regenerate. Unfortunately, if it's already bone on bone, it's a little bit too late for stem cells, but it's not too late in essence of like faster healing. So after surgery,
You can use them to heal faster.
absolutely.
I see.
Absolutely. It helps your body to accept the new organ.
I see, okay. So there's a plethora of benefits from using the MSCs, the mesenchymal stem cells, from reducing inflammation to accelerating healing to possibly generating new tissue.
Yes.
I don't know which ones I've had, but I can tell you it's definitely been a wonderful experience for me, which is why I've asked you to bring me more stem cells today.
Yes.
for my treatment today. The last few times that I've used it, it really has, as I said, turbocharged my prolotherapy with PRP, giving me a much better, much faster and better anti-inflammatory effects,
Yeah.
Pain relief, and longer effects. I've noticed I'm going longer and longer in between my therapy sessions. It used to be I was getting treatments every 3 months, then it was every 6 months, and now it's been a year and a half.
Yes, yes.
That I'm going in.
And you're doing great.
I am. My pain went from a 6-7 down to about a 3-4 out of 10, and now it's like a 0 to a 1, which
Wow.
I'm delighted. You
Yeah.
can't imagine how horrible it is to live with pain day in and day out. It is just maddening.
It affects your livelihood and your work.
Every aspect of your life, every aspect of your life.
I'm an example too. I mean, we're both voice of experience because of our.
You've had chronic pain.
Well, I had an ACL tear on my left knee. Our local ortho injected my knee with 1 cc of stem cells. Actually, the day he saw me, I was limping. I went to work. I didn't wear heels. And he's like, let's just inject you. Let's help you out.
Not steroids, though.
No, no, no.
Thank goodness.
No, not at all.
So he was an enlightened orthopedic surgeon.
Yeah, he just did it right there in the office. And
Very
I was
good.
convinced because the next day, pain was gone. I was in heels. So,
The next day.
yes, yes.
Wow.
Pain-free. So
Wow.
my very first experience. So after that.
Is that what got you into stem cells?
Yes. Well, I was already working for the laboratory, so.
Was it your own stem cells he injected?
No, no.
Some other
These
laboratory.
are allogeneic stem cells from donors.
Oh, got
and
it.
just to let you know, our stem cells, I favor them because I know their safety and the quality. We work with the laboratories that are FDA regulated.
Tell me about that.
Yes, so we screen our donors. We're in several hospitals in the United States, and these donors are moms that are about to give birth. So the screening process is your history, your physical, where have you traveled to in the last 3 years, and also blood screening to make sure you have there's no infectious disease markers.
Got it. So healthy babies, healthy moms.
Healthy babies, healthy moms. On the day of delivery, moms, when they give birth, they actually cut the cord between baby and mom, and in that cord is where they extract the cord blood stem cells.
So this is stem cells from cord blood, like pure, real pure stem cells.
Yes, absolutely. Wow. So there's a big vein in that cord, and they extract the cord blood. It is put in a blood bag, and within 24 hours, all of this happens. Birth, cutting, extracting, shipped directly to the laboratory, cryofrozen immediately within the first 24 hours. And again, the blood is screened again after delivery to make sure there's no bacterial infection during handling and processing. So that is shipped out. It actually takes 19 days from a third-party lab to get the results. These are FDA-mandated testing, such as HIV, hepatitis, Zika. They're all tested. It's a 14-panel test. We get the results back after 19 days, and if they are passed and infectious-free, that's when we're able to ship it out to hospitals for clinical research, IRBs, INDs, doctors' clinics such as Dr. Patel and yourself for doing their own clinical studies on their own patients. And if I didn't say so before, during the 19 days that we're waiting for tested, they're already cryofrozen in -240. These are big giant tanks. And this is the same laboratory that actually stores cord blood banks for moms that want to store it for 20, 30 years.
Right.
I think they pay like anywhere from $3,000 to $5,000
Right.
to store it in the event that your baby develops
Needs that
autism
blood in
or
the future. That's a booming.
Or cancer.
Yes.
That
Well, I
could
knew
save
that your
lives.
company came highly recommended, which is why I sought you out to get those stem cells from you for my needs, which is great.
Yeah. I mean, we have to be the voice of experience. And I work directly with the CEO. He just sends me on WhatsApp, oh, look, about the balding.
Yes.
As long as you have hair follicle,
Right.
he has grown his hair, and he's shown me the before and after with stem cell therapy. So
Well, you
there's
have,
hope.
but not if you're bald as a cue ball.
No.
Right.
You need
You have to have something
existing
there.
follicle.
You have to have something there, right?
Yeah. I mean, you don't need that for your hair.
Well, it's been a delight having you here, and I'm glad that we can share this with our audience because, and you know, it's funny, I was just saying earlier, 21%, 2 out of every 10 of the population has chronic pain, and here we are, both have experienced that.
Yes.
It's far more common than people think, and it's great to be able to get the information out there. People do not need to suffer when great technology like this exists.
Yeah.
We just need to get the information out there.
Yeah, I mean, I do it every year, even if I don't have an existing injury. I do the IV infusion. I learned this actually from my Chinese clients. Chinese have been doing this longer than Americans. They do it primarily for preventative treatment and anti-aging.
Right. Well, right. I'm aware of that.
Yeah.
I'm aware of IV stem cells for anti-aging.
Yeah. Any genetic diseases that you're prone for, you can prevent that with stem cell therapy.
That will be the subject of a future video. Thank you for joining us.